Yes.
Okay. Have you been using them?
We got a quiz coming up on Abrams. Abrams quiz. I mean, one of the
Okay.
questions on Abrams chapter.
Okay.
Okay, this is for the drug therapy.
Yes. These
Okay.
are the chapters that go with, so I went into your actual syllabi, usually when I pick out your study stuff. So this is chapters 49 through 52. I think there's some from pain management in here also, chapter 12 maybe, or whatever it is in Abrams. It might be chapter 3 in Abrams.
Now, chapters, let me see, 60 would have been from our first exam. The Abrams that follows along with exam 2 would be chapter 14.
Okay,
11.
so let's go back then.
Yeah.
Okay, so you're saying chapters, what chapters?
14, 11. Is that it that they have for exam 2? Yeah, 14 and 11. That's what's on the syllabus for exam 2.
Okay, so those are the only ones you guys want to cover? Say it again.
There are some ones from the previous, like, but we were not quizzed on them. I think it was, I forget, it's two other chapters, maybe 12, and I forget the other chapter, but that was ahead of it. I don't know if that'll help us with 11 and 14. Yeah, because that's treatment for, I think it was.
Let me just go up. I have the syllabi up. Okay, so week 1, you guys did chapters 49 to 52. Week 2, you did chapters 60 and 59. Week 5, you were chapters 14 and 11. You stayed in 11, it looks like.
Yep.
And it says chapter 71, but I couldn't find chapter 71.
Oh, that's for week 7. Yeah, chapters. 7.
Unless it's down here somewhere. No, it only went to chapter 60. I couldn't find a 71, so I don't know why. All right, we'll go with what we got.
It's waiting.
Can you see it okay?
It's, yeah.
Wait. Okay. Why didn't it let me pick an answer? Do I have to do something different?
Oh, wow.
It's not letting me pick nothing. That's crazy. Okay, well, I guess we ain't doing this right now. I want to do it.
Have you used these questions before?
No.
Oh, okay. Huh. I wonder if it makes you just select and go.
Let me just see, but it's not even like given, it doesn't highlight it or anything when we select it. That's the only thing. Let me
Mm.
do a stop screen share and see if that makes a difference. Okay, I think we got something going now. Okay, so I don't know. I picked it a chapter at a time, so we'll just do a chapter at a time, I guess, and then come back and let me put it up that way.
Oh, okay. What chapter is this one from?
This is 11.
11? Okay.
Yes. So you guys can
Okay.
read. I'll let you guys read because I like to hear you read.
In addition to autoimmune disorders, immunosuppressant medications are used to treat which of the following disorders? Would it be D?
That's
Bone cancer. It could be. I'm kind of thinking about C also.
Mm-hmm. Okay, yeah. It is Crohn's. And
Because
for
Crohn's
Crohn's.
is, you know, you got that constant anti-inflammatory response.
oh yeah, with the stomach issues.
Yeah. So the autoimmune disorders share inflammation as a major mechanism of tissue damage. Allergic asthma, Crohn's disease, psoriasis, and psoriatic arthritis and rheumatoid arthritis are also inflammatory disorders that can be treated.
Okay.
So bone cancer, I would think more of chemo for that. Chemo and then pain medications. Which the chemo could immunosuppress the person, but it's not an immunosuppressant. It's trying to target those tumor cells, those, you know, rapidly growing cells, as we call them.
Okay.
Immune disease. Oh, I was taking notes. A 56-year-old female patient has been discharged from the hospital following a successful kidney transplant. And her medication regimen includes anti-rejection drugs. When performing health education with this patient and her family, the nurse should emphasize which of the following. All right, so when performing health education with this patient and her family, the nurse should emphasize which of the following. We got strategies for reducing the patient's risk of infection, the safe use of assistive devices, the role of nutrition in health maintenance and prevention of rejection, and strategies for managing the patient's energy and activity levels. They had a kidney transplant and she is taking medication so it doesn't reject. So risk for infection is, you know, you definitely want to keep that at the top of the ladder. And let me see, safe use of this, no. I like A.
Okay, you're going to do all these, okay? You are going to do all these, but
Okay.
which one are you going to put the most emphasis on?
What it you want it? There you go. Infection.
It's definitely the infection, because when someone's immunosuppressed, what you have to worry about is they get a slight temperature. something can be going on with them. Okay, if their temperature, normal temperature is 98.6. If their temperature is 99.6, you're looking at them. All right, especially if they don't have a spleen. So anything that makes these patients at risk for infection, you got to jump right on that, because that's just going to lead to more complications and make it harder to treat. All right, if you need more time to in between the slides to take notes, just say so.
Okay.
All right, so you're going to do all these things. All right, we want to teach our patient about safety if they're using any sort of devices. All right, we're going to teach them about nutrition. All right, and about how to prevent, that making any further complications for those anti-rejection drugs. They're going to come with some risk right away. All right, the main thing is that they're going to be extremely susceptible to an infection. So that we have to make sure doesn't happen.
A patient is taking immunosuppressants. Consequently, the nurse must prioritize assessment for which of the following? One is immunosuppressant. It's not hyperglycemia.
So we know hyperglycemia goes with steroids, right?
Right.
Okay.
So when you're immunosuppressant, it's with your red blood cells, right?
Immunosuppressant means it's going to suppress what fights infection?
White blood
White
cells.
blood cells.
It's going against our immunity. So our immunity protects us, right?
Mm-hmm.
So when we're taking an immunosuppressant, it's suppressing our body's ability to fight. It's suppressing our body's ability to protect us.
So
Okay. Anemia is associated with red blood cells, hemoglobin, that kind of thing. Infection is associated with immunity. Okay. And ecchymosis is associated with some sort of bleeding or bruising. Okay. Bruising is usually associated with bleeding.
Mm-hmm.
So when you think immunosuppressants, think that it's suppressing my body's ability to fight infection. It's suppressing my immunity. That's why, we got to be careful about who we give this to. But a lot of times we have to give it to people because what's going on is, worse at the time. But we know that the risk of us giving this also puts them at a higher risk for infection, and they already have other things that is beating their body down. So now what kind of risk are we putting them at?
Patient has been prescribed oral cyclosporine following a successful liver transplant. The nurse should advise the patient to avoid mixing the drug with deli products, unfiltered water, any low pH beverage, grapefruit juice.
So cyclosporine, what kind of drug is it?
Cyclosporine. It's something with cyclosporine.
Okay.
Immunosuppressant. I think.
That's right. It's something with the immunity, with the immunosuppressants. Yes.
Nurse should advise the patient to avoid mixing the drug with
Unfiltered water.
Okay. I like the unfiltered water because what are you worried about with the unfiltered water?
Bacteria.
Yeah, bacteria. Okay. They throw grapefruit juice up there, and that could be an answer, for any drug. Okay, but they throw it up there because they know that it could be an answer with any drug. Okay. Dairy products, okay. A lot of things you can't take with dairy products, like tetracyclines. They have to be 2 hours apart from dairy cyclines from tetracyclines. So my, rhyme for tetracyclines is Tetracyclines will knock you up, meaning you have to take extra birth control if you take them. You can't have them if you have milk in your cup, meaning they have to be 2 hours away from dairy products. They're not for kids under 8, they're for grown-ups. So you want to think about, what can I think about with this cyclosporine that I could put together so that it tells me the answer. So it was the grapefruit juice, okay?
Yeah, grapefruit.
So, but your thought was there, okay? You were thinking immunosuppressant was something with bacteria. Grapefruit juice, like I said, they throw it up there because there's a lot of things you can't give with grapefruit juice,
Mm-hmm.
okay?
Gotcha.
And this happens to be one of them.
Mm-mm.
A transplant nurse is providing patient education prior to an organ transplant and is addressing acute versus chronic rejection reactions. Which of the following explanation would be appropriate to provide to the patient?
Inappropriate.
Inappropriate to provide to the patient.
So which one is wrong?
Acute reactions may occur from 10 days to a few months after transplantation. Acute reactions can lead to arterial narrowing or obliteration of
Obliteration
blood flow to the organ.
meaning that it's not going to get, complete flow.
Okay. And we got acute reactions are not responsive to treatment with immunosuppressant medications. And characteristics of chronic reactions include fibrosis of blood vessels and progressive failure of the transplant organ. Which one is wrong? Prior to organ transplant, addressing acute versus chronic rejection. Okay. I'm not too sure about acute reactions occurring from 10 days to a few months after transplant.
I think that can happen. It is 10, I'm not sure the days, but it can happen.
Right.
Um,
But 10 days to a few months from when it would happen, I don't know.
yeah. They're
So
like,
you're feeling like the time frame of a few months might be more than acute. Is that what you're thinking?
Yeah,
Like the 10 days kind of matches the acute, but the few months might be more of a characteristic of a chronic reaction. Is that what you're thinking?
could be, yeah.
it does, the reaction do cause narrowing and blood flow to the organs. I'm not sure about C, but
Are not responsive to treatment. Immunosuppressant.
I forget. Mm,
I don't know about not. Not responsive to treatment.
Okay, well, let's go to page 181 on Abrams, okay?
okay.
Rejection reactions may be either acute or chronic. Acute reactions may occur from 10 days to a few months after transplant and may involve cellular immunity, proliferation of T cells, characteristics of organ failure, and inflammation of blood vessels leading to arterial narrowing or obliteration. Treatment with immunosuppressant drugs is usually effective, ensuring short-term survival of transplant, but does not prevent chronic rejection. Chronic reactions, which occur after months or years of normal function, are caused both by humoral immunity and do not respond to increasing immunosuppressive drug therapy. Characteristics include fibrosis of blood vessels and progressive failure of the transplanted organ. So I would have to say that C might be the correct one, because the reaction is responsive in a way to the immunosuppressants, but it doesn't prevent the chronic from occurring. So everything else up there looks like it's true from what I'm reading here.
Right, except for C.
So the immunosuppressants will help as far as the short-term survival of the transplant itself, but it won't prevent the chronic reaction from occurring. All right, so they can give these immunosuppressants and it might help that transplant survive, but they may have to do additional measures in order to prevent the chronic rejection. Do you understand that?
Mm-hmm.
We good there? Okay.
The patient underwent a solid organ transplant several years ago and has remained largely symptom-free. The nurse should be aware that the patient's long-term use of immunosuppressant creates an increased risk for increased risk for organs. Is it renal failure?
Answer.
Cancer may result from immunosuppression.
Wow. T lymphocytes.
T lymphocytes and NK cells are suppressed and unable to recognize and eliminate the abnormal cells. The abnormal cells can undergo spontaneous malignant transformation. Can't read this morning. So that makes sense, okay? Because we're giving these immunosuppressants, right, to get rid of things. So they may target these killer cells, okay, the T lymphocytes and the killer cells.
Because they don't
Right.
work. Right.
And then they're not able to recognize those abnormal cells.
Gotcha. Wow.
Right, so a patient is scheduled to begin treatment with Mycophenolate. When providing health education to this patient, the nurse should encourage which of the following? Right, so crushing the pills and mixing them with applesauce or jam, holding the pill under the tongue for 30 seconds before swallowing, taking the pill on an empty stomach, and taking the pill only if there are early signs or symptoms of infection. So, mycophenolate. Right. It's another immunosuppressive drug. So when providing health education to this patient, the nurse should encourage which of the following? Taking the pills on an empty stomach.
Okay, good. So this comes in extended release form. All right. It's an anti-metabolite. Now, I would encourage you guys to watch this videos. Just to just give you a really nice overview of cancer drugs in general. It take about 45 minutes of your time. It's a 3 video series.
On YouTube?
Yeah, it's called Charlotte Barker.
Okay.
Anti-neoplastic. Okay, 1, 2, and 3 you want to watch. She'll give you a really nice overview about your oncology drugs, and she'll teach you little tricks and stuff, how to recognize different things.
Okay.
Okay.
Charlotte Barker. Okay.
All right, so this is an anti-metabolite, okay, and liver function you have to really consider with these patients, okay, and just read about it. This drug, okay, this you can find a lot of information on page 182 in your book on Abrams.
Okay.
Oh, you're gonna take these whole, by the way. All right. So good job of not picking the applesauce and the other one. A lot of these drugs are really toxic. All right. You got to be careful about handling them, even as the nurse. We don't want certain people handling these drugs if they're pregnant. And you also have to wear certain types of PPE when you handle these types of drugs. So you really have to be aware. You would never crush them and put them in applesauce. They're also extended release.
When reviewing information about immunosuppression following a solid organ transplant, the nurse should understand that it's a okay immunosuppression following solid organ transplant. The nurse should understand that so immunosuppression, are they at increased risk for infection if the suppression is inadequate?
So if the goal for this is to provide adequate immunosuppression and minimize the adverse side effects on the normal body tissue. All right, so if immunosuppression is not adequate, then the graft rejection reaction will occur with the solid organ transplant, and graft versus host disease will develop in the bone marrow stem cell. If the immunosuppressive drug is excessive, then a serious infection could occur.
Okay,
And lymphomas, skin cancers, and stuff like that can develop. Organ damage related to these rapidly growing lymphocytes in the normal body tissues can occur. So in this case, I believe 1 is the correct answer.
okay, so it's graft versus host. But if it was the opposite, then it would be the infection when it
Yes.
targets it. Gotcha.
If it's too much immunosuppression, if it's excessive.
Mhm.
Oh, it's B. Okay, so I read A wrong then. If immunosuppression is inadequate, graft rejection occurs with solid. Is that what we said?
Solid organ.
If immunosuppression, yes, that's what I said. If immunosuppression is inadequate, graft rejection will occur with solid organ transplant.
Yeah, that's what you said, but you
That's
just
what I said. I just picked the wrong one.
Yeah. Yeah.
And the graft host disease will occur with the bone marrow cell transplant.
A graft versus host, that's when somebody else give it to that person. That's graft versus host, right? Say you gave me, so it came from somebody else.
All right, I'm going to look at it. I'm going to look at it because I want to make sure I give it to you right. So it looks like the T cells in the donor bone marrow attacked the person or the host receiving it, attacks their tissues, producing inflammatory changes. This can also occur with the blood transfusion. So it's when the T cells that come from the person who gave it to you attack the ones that belong to the person receiving it.
Right. But when it's a solid organ transplant, that means it's not coming from the graft versus the host. It's actually coming from whatever. I forget what they I forget. It start with an A though. So that makes that
Oh, the autoimmune?
No, I don't think it's autoimmune. I think it's I forget. But that's what makes this one. To be able to differentiate it when reviewing the information about immunosuppression following solid organ transplant, I think one is excluded because that's graft versus host, and this is saying a solid organ transplant. Or that's not true, Sue.
Well, see, what one is saying is if immunosuppression is inadequate, the graft versus host disease reaction occurs, and that's not true. The graft versus host disease occurs when the T cells from the person that's giving you the donation attacks the cells of the person that's receiving it.
Absolutely.
If immunosuppression occurs, the graft rejection occurs within a solid organ. So it doesn't have anything to do with the graft versus host.
Right.
If we don't give enough immunosuppression, then our own body, our own organ is going to reject.
Right.
But in A, that's something different. A, it has nothing to do with the immunosuppression. A has to do with when the person's, whoever the donor gives it to us, for some reason, their body and ours don't
mix together.
Yeah.
Right.
Yeah. And then D is saying that D is incorrect. D would be the opposite. If we had too much suppression, too much immunosuppression, it would put our patient at a higher risk for infection.
Right.
So 3 different statements there, but one is incorrect because really the graft versus host disease occurs when those T cells from the other person, our body produces antigens that those T cells don't like, and they start to battle.
Right.
And that causes the rejection because those two are battling against one another.
Gotcha.
All right. So the other one has to do with medication. B has to do with the amount of medication or the amount of therapy that we're giving the patient.
Right.
Okay. Are we good now? Okay.
Float nurse is providing care for a patient whose medication administration record includes a scheduled dose of tacrolimus, Prograf,
tacrolimus.
Prograf. The nurse should recognize this drug as a conventional anti-rejection agent, an antibody preparation, a tumor necrosis factor, alpha blocking agent, fusion protein inhibitor. All right, so it's an immunosuppressive drug, but the nurse should recognize this drug as a conventional anti-rejection agent, as it's an immunosuppressive drug. So let me finish reading. Let me just read again. An antibody preparation, tumor necrosis factor, alpha blocking agent, fusion protein inhibitor. I mean, it prevents organ rejection. So I'm gonna go with A.
Conventional anti-rejection agent. Okay, good.
Which of the following statements indicate that a patient understands immunosuppressant therapy following a solid organ transplant? I know that I will need to stay on the medication for the rest of my life. I know that I will need to stay on it for at least a year. That's A. They're on it for life.
Okay, good.
Hold on for 1 second. Okay.
Now, if you read this statement, it even makes it a little more clear because it says for those with solid organ transplant, they have to avoid graft rejection, okay, serious infection, those two things, the immunosuppressant, to avoid graft rejection and serious infection. So you see there, it doesn't even talk about the graft host.
Mm-hmm. A patient with chronic renal failure has just been scheduled for kidney transplant with his brother acting as the donor. The nurse will be aware that administration of anti-rejection drugs would be initiated when several hours before the surgery, 48 to 72 hours after surgery, and post-anesthetic recovery as soon as possible. I kind of remember 48 to 72, but I'm not.
I want to say they start these
Before
beforehand,
surgery.
before
Yeah.
the surgery.
Before surgery?
I believe so.
Okay. Several hours before.
Yeah.
Hold on for 1 second.
Because the body has to get ready, you know, before you put the actual organ in. Once it starts rejecting that organ, I believe the organ has to come out.
Okay.
Because otherwise, I think it will destroy the organ. But it may anyway, but.
A patient who has undergone an organ transplant is at greatly heightened risk of health problems because a transplant interferes with the immune system ability to sequester the T cell, the body's ability to synthesize protein, the bone marrow's ability to is D.
Yeah, I'm thinking it's definitely D because we just talked about this, right?
Mm-hmm.
That the body's ability for the killer cells and the T cells to be able to recognize foreign cells or abnormal cells. Okay. Good. Let me know if you guys need longer time for the rationales.
Patient with colorectal cancer is being treated with methotrexate. what aspect of this patient's current health status would prolong this drug's half-life? Vascular disease, renal impairment, presence of active infection, inadequate renal impairment.
That would be my guess because the kidneys help remove, okay, the kidneys and the liver, right? So if one of those isn't working, then that definitely should impair.
Okay. Mycophenolate, Mofil cell set is being considered in the treatment of a 39-year-old female transplant recipient. Before the initiation of therapy, the care team must ascertain which in order to ensure safety.
So you're given these toxic drugs, you know,
You don't want to give them the
what's
pregnant.
going to be the side effects. So there's only a couple of things that you're going to consider, and you know, things are going to be kidney function, liver function. It could be C, the patient's response to cardiac, and of course A. Those things are all things you're going to take into consideration anytime you're given these drugs.
But a 39-year-old female, you want to make sure she's not pregnant.
That's right. Okay, the ability to pay and the social really makes no bearance or shouldn't make any bearance on being able to treat.
Okay.
I like the way you're pulling the clues out. This is what you got to do when you answer these questions. You got to pull the clues out.
Okay. So a patient has begun immunosuppressive therapy in preparation for transplantation. When explaining the risk of immunosuppression, the nurse would include which of the following? So we got excessive immunosuppression be corrected fairly easily with other medications. Inadequate immunosuppression increases your risk of developing an infection. Once the transplant is complete, complications associated with immunosuppression are no longer a concern. Serious complications can occur if you are not monitored carefully while you are immunosuppressed. So when explaining the risk of immunosuppression, the nurse would include which of the following?
Well, A, we're not really, A is not something we want to try to do, right? We want to prevent that, right?
You're right.
We want to prevent it. Why? What would excessive immunosuppression cause?
Would it be infection?
An increased risk for infection. So B is not true, right? Because too much immunosuppression would increase my risk for infection.
Right.
And is C true?
No.
Okay, so that only leaves you with one answer.
Right. Yeah.
Okay, Judge Judy says if it doesn't make sense, it's not true. So use your senses because you can actually eliminate some of these with just a little common sense.
That was chapter 11.
Yeah. Okay, what was the next one we were going to do?
Did they give you more questions or that's it for 11? All,
I think that was all. There was only oh no, it let me, I don't know if I did enter, but it did give an option for 50 questions.
oh, okay. Okay. All right. So yeah, that was 11.
Oh, wait a minute. That's not the chapter we want though.
$14.
Sorry. Let me figure out how I did this now. I shouldn't have had to go back out. Oh, that was chapter Oh, this was the one that wouldn't let us. Okay, maybe we can do it this way. Maybe it's going to let us. Let's see. All right, what other chapters were we looking for?
Chapter 14.
Okay, I got that checked, so. Oh, see, that's, oh, okay. I guess we could just hit check answer. So let's see. Can you guys see it?
Mm-hmm.
All right, so let's see what happens when we try it this way. So go ahead and read.
Cytotoxic anti-neoplastic medication can produce several adverse effects that can affect the patient's quality of life. In caring for patients undergoing chemotherapy, the nurse should monitor for which of the following.
So it's definitely going to be more than one thing here. I'm pretty sure this should probably be a select all that apply.
So they're going to have nausea, mucositis,
Okay.
peripheral neuropathy.
Okay.
I
With
would
certain
choose those.
drugs, I definitely say with certain drugs, they're going to have that. And I would say probably some loose stools.
Okay, diarrhea.
So the neuropathy, you're only going to see with certain things.
Gotcha.
Okay. So that's why it's not up there. And definitely not the increased urine output. Oh, now it doesn't give us the answer thing. How about that? Isn't that crazy? Okay, so now I guess we got to go back to where we were. Stupid. The book don't want to work the way I want it to work. All right, so we try 14. What?
Mm.
It don't recognize me as being signed in. That's all it is, probably. Try it again. No.
Problem with these things.
Oh, that's 10th edition. I don't want that anyway. We should be using the 11th edition, right? Maybe that was the problem. Oh, look, it brought us into the new one. So now let's just see one more thing then. If we can do, maybe that was the issue. Oh, wow. Okay. So 14, because we did, I'm going to pull 11 back up just in case it gives us some new ones. All right, 14, 11. What was the other ones?
Well, for this exam, it's just 14 and 11. But if you want to go into previous chapters, It was 49 through 52.
Okay, so let's just go with that and see what it gives us. What the hell? Okay, that didn't work either. All right, now we're just gonna go to 14 and try that. I don't know what this weird thing is doing. Okay. I can't do strange. All right, so this is the one we just did. Can you guys see the questions okay? Is that too small?
A little for me.
Okay, I might have to pull it up on my other screen then.
Oh. So I can make it work.
Come on. How's that better?
Yep.
Okay, now let me shut this sound off over here. Okay, how's that? Oh, still got a little. Trying to figure out how to shut the microphone off. Oh, okay, here. All right, how's that better? Can you hear me?
Mm-hmm. Yep.
Okay, good. All right, so let's pick these because we already had this. Yeah, we picked the right ones the first time. Okay. All right. Okay, it says 2 on my screen. Why is it the second question? What?
Sometimes it take a minute to switch. Sometimes.
Mm-hmm. Or sometimes it just, you got to start all over.
Yeah, sometimes you gotta reset it.
What is it doing? It's acting wacky. I think it might have to be because we're in this Zoom. Okay, I think we're good.
Okay, so among the multiple genetic abnormalities that are characteristics of cancer cells, which gene mutation results in more than 90% of small cell lung cancer and more than 50% of breast and colon cancer?
I think it's the P53.
Okay, good. Mutations of the P53 gene, a common genetic change in cancer, are associated with more than 90% of small lung cancers and more than 50% of breast and colon cancers.
A nurse educator is discussing the role of proton cogenes in the pathophysiology of cancer. What typically triggers protocosagenes to differentiate into oncosagenes? Is it the low exposure? Exposure to carcinogens, or is it ischemia?
So proto-oncogenes
Mhm.
in the pathophysiology of cancer. What triggers proto-oncogenes to differentiate into oncogenes? So, it's changing now. What's causing it to change?
The carcinogen? No. Maybe. All right, hold on. Let me read this.
I had to bring your book up on another screen, so I'm getting there too.
It's probably carcinogens, though.
It's A.
Exposure to carcinogens.
Mhm.
Okay, good. When proto-oncogenes are exposed to carcinogens and genetically altered to become oncogenies, they can stimulate growth continuously, allowing abnormal, disordered, unregulated cell replication.
I have to sneeze, but nothing's coming, so. What is the defining characteristic of sarcoma? Congenital in nature, originate from the connective tissue, attributable to endogenous carcinogens.
Endogenous. So that means within, carcinogens within the body, right? Because exogenous means carcinogens from outside the body.
Okay, and then you have, what's that?
Sequestered.
Or muscle tissue.
It's either B or D, but I think it's B. It's connective tissue.
Yeah.
So where do these sarcomas usually originate?
In the tissue.
Okay.
Sarcoma, it's B.
Good. Okay, sarcomas are derived from connective tissue like muscle, bone, cartilage, fibrous, fat, or blood vessels. They're not sequestered within other tissues, and they're not the result of endogenous carcinogens. They're also not a congenital health problem.
What rationale should the nurse provide to the client when describing the necessity of recovery periods between treatment cycles of chemotherapy? Thomas, well. Mm, mm. Is D.
Time is needed to replace many of the healthy body cells killed by chemo.
Yep.
Good. Cyclic administration involves taking drugs for a specific period with a recovery period following each treatment cycle. The recovery period allows time for the client to produce new healthy cells to replace normal rapidly dividing cells that have been affected by the drugs.
A recent nursing graduate is receiving special training to become certified in handling and administering chemotherapy drugs. This special training is necessary because of what nursing diagnosis among clients receiving chemotherapy. Risk for contamination related to chemotherapy, risk for injury related to chemotherapy, risk for ineffective health maintenance related to chemotherapy, and risk for acute pain related to chemotherapy. Probably risk for either A or B. Risk for injury. Risk for health maintenance.
Wouldn't this be safety? So B probably.
Risk for injury. And risk for contamination. Well, we can pick B.
Oh, I'm trying to pick it on the wrong screen. Okay, good job. All right, so these drugs can, injure someone. They're very toxic, so they can injure people administering them. They can injure people taking them. They can injure anybody really exposed to them.
The dosage of chemotherapy agent that will be administered are based primarily on what client variable. It's going to be weight.
Good. Okay, important to use weight base.
When assessing a client for adverse effects related to methotrexate therapy, the nurse should prioritize what laboratory findings? Serum osmolarity, electrocardiogram, calcium and magnesium levels, and creatinine clearance. Related to methotrexate. I remember
I'm not sure. I think it's the creatinine clearance. It's something with the kidneys.
Okay,
I
that's
remember that.
telling us about kidney function, right? About how it's eliminating in the body.
Mm-hmm.
Okay, good.
What health education topic should the community health nurse emphasize when planning care for a client who will be prescribed an oral chemotherapy drug for the next several months while recovering at home? I think it's A, safety, handling the drug.
Okay, and let's just look at the other answers for a second. Okay, so ways to match the dose to the severity of his symptoms. No, we're not going to do that. Self-monitoring of the liver. I mean, there are some things that might give him a clue that the liver status is off, like nausea, vomiting, yellowish tint of the skin, itching on the feet and the hands. But he's going to need really labs to monitor that kind of stuff also. Right. And then, yes, we are going to talk to them about herbal drugs that they could take with the chemo, but we probably won't discuss substitutes.
The nurse should encourage the client to implement which intervention in order to minimize the risk of developing chemotherapy triggered mucositis. I can't pronounce that. Gargle with
Mucositis.
commercial mouthwash. Mucositis. Gargle with commercial mouthwash 3 to 4 times daily. Thoroughly rinse his or her mouth often, especially before and after meals. Self-administer 650 milligrams of acetaminophen 4 times daily, and limit fluid intake to prevent overhydration of mucous membranes. So,
All right. So, 4 we never do unless the person's life depends on it. We don't limit fluids unless they're in heart failure, kidney failure, something that it's going to make it worse. Right. So we could throw that out.
B, but I was going to talk about what else we can throw out, and it just
B is true, yes, and you could throw out C because that's not your advice, right?
No.
First of all, you're not going to want your patient taking Tylenol 4 times a day, especially if they're on a drug that could affect liver function.
Right.
All right, because we don't want to make the liver any worse, and that's Tylenol is going to do that all day. But you wouldn't give it for this anyway; it's too invasive. And we know we don't use commercial mouthwash, so yeah, I mean, you're just going through the process of eliminating, even though B is the right answer when you look at the question. I want you to go through that process about the other things, why it's not the right answer.
Right.
Because when you get to other harder questions, it's going to help you.
What potential benefit is unique to the biologic agent therapies? They may affect cancer cells while leaving normal body cells unaffected. Administered does not require certified. No. Cytotoxic adverse effects are rarely and they may be administered long term without the need for regular. That's not true. So A is the only one that can basically.
Good. Okay, biologic agents target cell differences between malignant and normal cells. They may kill cancer cells and leave the normal body cells unaffected. They have adverse effects like chemo drugs. They require exceedingly careful administration and they must be closely monitored. All right, so they do require regular blood work. All right, tamoxifen, this is something we give a lot for breast cancer. So they like to test on this.
Okay, so tamoxifen achieves a therapeutic effect by which means cause a mutation of cancer cells, slowing the growth of cancer cells, inducing apoptosis of cancer cells, increasing the viability of health cells that are adjacent to cancer cells.
That's a breast cancer. That's for breast cancer, right?
Yeah,
Correct.
I think it's the slowing the growth of the cancer cells, because they give it to them long term. I forget. I hmm.
20A and B.
I don't really like A. I think your answer is probably B. Because I feel like mutations of the cells would cause them to grow more.
Mhm.
But let's see. So usually our chemo drugs, we try to slow the growth of the cancer. Because if we could stop it, we would already be curing cancer, right?
Yeah.
But usually when cancer cells mutate, they usually mutate into a new type of cell. All right, that was 14. All right, so we did 14 and 11. You guys want to go to regular questions now, or you want to do more drugs?
It don't matter.
I just wanted you to get a little exposure to the drugs because we weren't doing any of those. So maybe I have it up on this screen because I did have it up already. All right, can you see the questions okay, or you need me to put them back on the other screen?
There's no questions.
There's no questions? That's because I guess I got to go back to this share. Where's my, okay. How about now?
Yep. On chapter 12.
So I can nix this chapter because you guys didn't want to do this one, right?
I would rather go over some that's going to be in this upcoming exam.
Okay, so here's our choices here.
I think last week we did do week 4.
A mess.
I don't think we did week 5 last week. We definitely didn't do week 6.
Okay, so tell me what chapters you want to do.
We can do. I just want to make sure, because we might have did 15, 35, and 36.
15,
35.
35, 36. What about 37 and 38?
That's on there.
39?
No, not for this exam.
Okay.
I want to see 39 at all.
All right, well, let's start with these and then we can always grab more. Can we see them okay?
Mm-hmm.
Okay.
Yeah. Palliation refers to, let's see.
All right. Palliation refers to relief of symptoms with disease and promotion of comfort and quality of life.
Yes.
Good.
During which step of cellular carcinogenesis do cellular changes exhibit increased malignant behavior? Initiation, promotion, behavior, progression, and prolongation. Let me get rid of what I know it ain't. So initiation is out. We got progression. Increased malignant. I think it's progression.
Okay, progression is the third step of carcinogenesis in which the cells show a propensity to invade adjacent tissues and metastasize. During promotion, you have repeated exposure to agents that cause the expression of abnormal genetic information even after long latency periods, and during initiation, chemicals, physical factors, and biologic agents escape normal enzymatic mechanisms and alter the genetic structure of the cell's DNA. No stage of cellular carcinogenesis is termed prolongation.
Which class? Oh, my bad. Which class of anti-neoplastic agents is cell cycle specific? Anti-metabolites, alkylating agents. Anti-tumor antibiotics. Is it the who?
By the
Is
way, Miss
anti-
Barker
Go ahead.
will bring this, Miss Barker will bring this to light for you.
Miss Barker.
Yeah.
Oh, with the videos. I'm gonna watch it.
Oh, okay. Anti-metabolites?
Yeah, I'm gonna watch it.
Yeah.
So you going with A, anti-metabolites?
No. That's C.
Oh, C, anti-metabolites, not anti-tumor. Okay. Good.
Okay. Whew.
Anti-metabolites are cell cycle specific S phase. And the rest are non-cell cycle specific.
Right. There's a cell cycle in the rest of the work.
Which should a nurse thoroughly evaluate before a bone marrow transplant procedure? Family history, blood studies, drug history, allergy history. I think I remember this being blood studies. Bone marrow transplant.
Which, I'm sorry, did you give me an answer?
Blood studies. Bone marrow transplant.
All right, good. So we want to evaluate the physical condition, organ function, nutrition, blood studies. All right. And past exposure to any antigens, as well as psychosocial status. Which is a growth-based classification of tumors?
A growth-based malignancy. Sarcoma.
Good. All right. Tumors are either benign or malignant. Tumors that are classified on the basis of the cell or the tissue are carcinoma, sarcoma, lymphoma, and leukemia. That's based on where it originates.
After a bone marrow transplant, the client should be monitored for at least
I think it's 3 months. This wasn't a.
Yeah, I think it was, 3 months.
Okay, good. At least 3 months. Complications can occur 100 days or more after the procedure. Infections are extremely common.
Which procedure uses liquid nitrogen to freeze? Therapy destroying cells. That's cryoablation.
Mhm.
Good.
Chemotherapeutic agents have which effect associated with the renal system? Hypercalcemia, increased uric acid excretion, hypokalemia, and then hypophosphatemia. The increased uric acid.
I think that's what it is. I think you see only the hypercalcemia in certain types of cancers, like the bone cancers and stuff. And I believe it is from the destruction of the cells. Okay, from the end products after cell lysis. All right, the other ones are associated with the chemo agents.
Which type of vaccine uses the client's own cancer cells, which are killed and prepared for injection back into the cells? Is it autologous?
It should be autologous. Okay, autologous is from self. Autologenic is from someone similar to you. Prophylactic is prevention thereof. I just got to run to the ladies' room. Read this one real quick. I'll be right back.
A decrease in circulating white blood cells is granulocytopenia, leukopenia, neutropenia, thrombocytopenia, and decrease of neutropenia.
Okay, what do we get? C?
Yeah.
It was B.
Leukopenia.
Um,
Oh yeah. Low white blood cells.
yeah.
Yeah.
All right.
Neutropenia is when it's
Absolute neutrophil count.
neutrophils. Yeah.
All right. My bad too, because I said the wrong one also. Oh, wow. Can't be perfect all the time. How about not even most of the time? All right.
Wait a minute, which is a sign or a symptom of septic shock? I should know this. All right, septic shock. More moist skin. Increase urine output. Alter mental status?
That would be my guess because everything else I would say no. But we know in any type of shock that what's going to happen is the body's going to perfuse the most important organs, and the brain is not considered one of those. All right, so everything's going to go right to the heart and the lungs, and everybody else is going to be left behind. So kidneys shouldn't be functioning well. The skin is not going to be warm and moist, and generally the blood pressure is low with the high heart rate because the body's trying to compensate for it.
So which occurs when fluid accumulates in the pericardial sac and compress the heart.
This is a life-threatening emergency, and it has a very specific sound when it occurs.
The cardiac tamponade.
Yep, and you're going to have those muffled, what we call muffled heart sounds, okay?
Right.
Muffled or distance. DIC, you already know, is disseminated intravascular coagulation. A good friend of mine just died from that yesterday. She's 40 years old. She left behind 4 young boys, including one that she just gave birth to. And then superior vena cava usually happens, you know, with pregnant moms. SIADH is too much ADH. All right, and that's going to cause a different type of shock, like from dehydration or something like that. I said dehydration. SIADH would be fluid overload. Too much ADH equals too much fluid.
A serum sodium concentration lower than 115 is associated with anorexia, weight gain, myalgia, seizures, seizure.
Okay, good. Neuro always thinks, when you think in sodium, you always think neuro. All right, abnormal reflexes, papilla edema, coma, and death. Just wanted to see what it says about anorexia, weight gain, and myalgia are associated with sodium concentrations lower than 120. Okay, I don't know why I put that up there, but okay.
So according to the TNM classification system, TO means no evidence of primary tumor.
Okay, good.
What type of surgery is used in an attempt to relieve complications? It's not palliative. It's not
You sure it's not palliative?
to relieve. Oh, wait a minute, hold on. Which type of surgery is used in an attempt to relieve complication? Oh, hold on. It's surgery though. What surgery?
Yep.
It's not reconstructive. It is not salvage. It's Give me 1 second. Let me.
So it can't cure the cancer usually, but what it can do is, like, if it's putting pressure on a spot that's causing pain, or you know, sometimes it can reduce the size of it.
Right. So it is palliative because prophylactic mean they're doing it in attempts to just in case or
To prevent.
Right.
Prophylactic means to prevent.
So it's palliative. It's not
Reconstructive would
salvage.
be to repair. And I don't know about salvage. I never heard of that. But I guess it is a real one. Okay.
It is.
Salvage is an additional treatment option that uses extensive surgical approach to treat the recurrence of cancer. Okay. I never heard of that before. So something new for me. All right. So palliative, yeah, is to, you know, those complications, that pressure, that pain.
Okay, we already got this question. A B. Which statement is true about malignant tumors? They gain access to the blood and lymphatic channels.
Okay. Just so you can see that all at once if you want to. Do we do this one?
Which does a nurse thoroughly evaluate before a hematopoietic stem cell procedure?
That might have been in the
Let's
Abrams. I feel like that was in the Abrams.
Is it blood study?
Yeah, I would definitely say blood studies.
Oh, the other one was with the bone marrow transplant. What do you evaluate?
Oh, okay.
It was blood studies. Yeah.
We did this one.
Yep.
Really? Let's stick on us here.
We did this one because we knew the answer, but still picked the wrong one.
And we did this one. Why is it bringing us the same one?
But I like how they do that because it kind of reinforces the information. And if you read the rationale, it keeps repeating it. Like, I like how Burner drills in the information. It
All
works
right.
for
Well,
me.
we can keep watching them. I'm good with it if you guys are.
Yeah, when I'm studying it, I like how they drill their information.
Okay, so you guys know this one, right? It's what?
No
primary tumor.
Whoa. Okay, I might have to slide this one over. But that's okay. Let me know when you're Well, I'll just read it. How about that? The nurse is providing education to a client with cancer radiation treatment options. The nurse determines that the client understands the teaching when the client states that which type of radiation aims to protect healthy tissue during the treatment.
Brachytherapy.
So it only targets the tissue that it needs to.
Mm.
Good. That makes it too small, right?
Oh,
A bit small.
All of a sudden, the question's got in a weird spot now. All right, a client with metastatic pancreatic cancer underwent surgery to remove a malignant tumor in the pancreas. Despite the tumor being removed, the physician informs the client that chemo must be started. Why might the physician opt for chemo? So even though the malignant tumor was removed, why would the physician still want the patient to receive chemo?
you don't want it to prevent metastasis?
I would think so. I would think that the tumor can still metastasize because even though we did surgery, there's never a guarantee that we got all the cells, right?
Mm-mm.
All right, so chemo treats systemic and metastatic cancer. It can also be used to reduce tumor size pre-op and destroy any remaining tumor cells post-op. Angiogenesis is the growth of new capillaries from the tissue of origin, and that helps malignant cells obtain the needed nutrients and oxygens to promote growth. Fatigue and stomatitis are side effects of the radiation and the chemo. All right, and a client with a brain tumor is undergoing radiation and chemo for treatment of cancer. The client has recently reported swelling in the gums, tongue, and lips. What is the most likely cause of these symptoms?
Excuse me. Goodness.
So nadir is what? That's like when your white blood cells at their lowest count, okay? Lowest count around. Neutropenia is that absolute neutrophil count is at its lowest, right? Is low.
Mhm.
Okay. Extravasation is when something like a chemo agent goes into the you're giving it in an IV and it goes into cells surrounding where that IV is, and it causes that tissue in that area to die. And then you know that stomatitis is when we have this inflammation and swelling in our lips and all that good stuff.
So, stomatitis.
Mhm.
Okay, and that usually occurs about 5 to 10 days after certain chemo agents, or sometimes after radiation to the head and the neck. A client is undergoing chemo for prostate cancer and has lost considerable weight due to nausea and vomiting. Which nursing intervention is appropriate for the client? What are we not going to do?
We ain't gonna give them beta blockers.
Okay, you don't want to give them beta blockers.
Not going to increase fresh fruits.
Okay, why we're not going to increase fresh fruits because that puts them at risk, right?
Yep.
Okay.
So you're gonna adjust the meal plan before and after chemo.
Okay, because we only do D in what? Life-threatening conditions, usually.
Right.
All right. We have to give adequate fluid and hydration to these clients. So the nurse is caring for a client undergoing an incisional biopsy. Which statement does the nurse understand to be true about incisional biopsies?
It removes a wedge or incisional.
Okay, good. 3 most common types: incisional, and needle. In an incisional, the wedge of tissue is removed. You already know with the needle, we take those cancerous cells using that needle. All right, and excisional, they remove the tumor and the surrounding marginal tissues. The physician is attending to a 72-year-old client with a malignant brain tumor. The physician recommends immediate radiation therapy. What is the reason for the physician's recommendation?
To prevent formation of new cancer cells?
Okay, good. Radiation helps prevent cell growth. The nurse is conducting a community education program using the American Cancer Society's colorectal screening and prevention guidelines. The nurse determines that the participants understand teaching when they identify that people over the age of 50 should have which screening test every 10 years.
Colonoscopy.
Okay, because some of these we have yearly, right? Fecal occult blood, the pap smear, and the PSA. Nurse is caring for a client with a benign breast tumor. The tumor may have which characteristics? Benign.
A slow rate of growth.
Benign tumors have a slow rate of growth and well-differentiated cells. Benign tumors do not invade surrounding tissue and they do not cause symptoms. The nurse is evaluating blood work results of a client with cancer who is receiving chemo. Client's platelet count is 60,000, which is an appropriate nursing action.
Appropriate or inappropriate?
Appropriate, because as I can see up there, there are 3 things that are inappropriate.
Providing commercial mouthwash to the client. You said is appropriate or inappropriate? I'm sorry.
Well, we're looking at blood work, okay?
Right.
The platelets are 60,000.
Uh-huh.
So what's our concern is that the patient can bleed. So I don't like A, but the other 3, you can't.
Don't sound right.
3B would only be if you had an electric razor.
Right?
Everything else, well, actually C would be your correct choice. That's what you would do.
Oh yeah, boy. Yeah. I was trying to see if it was inappropriate or appropriate.
I didn't read C correctly. Well, now that I read C, C is the correct answer here, right? Because we're doing things that avoid increased risk for bleeding.
Okay.
A is not a correct answer. So now that we reread C, we can see why A still remains not a correct answer.
Yeah. Okay, appropriate. Okay.
The nurse is preparing to assess a client whose chart documents that the client experienced extravasation when receiving the vesicant vincristine during the previous shift. The documentation also notes that an antidote was administered immediately. The nurse prepares to assess for which conditions. So what would you expect to see now that this extravasation occurred and we gave the person the
Goodness.
antidote?
So maybe they don't have active cleaning. The client experienced excavation. You ain't gonna see sloughing of the tissue.
This is a select all that apply. So I'm thinking that you might actually see A, B, and C. Hopefully we don't see D.
So active bleeding.
I mean, that would show that the tissue is granulating or starting to form granulation, that we had circulation restored in the area.
Mm-hmm. Mm. Sloughing of tissue. Mm. Okay, so B, C.
I want to say, almost say that A has to occur before B can occur, but you guys pick what you think here, because I'm just throwing some stuff out there, really.
B and C definite. D is out. A, it can be, I guess.
Well, let's pick B and C. What do you think, Nate?
I need to see the the question again.
Okay, so the nurse is preparing to assess a client who experienced extravasation when receiving the vesicant vincristine. So she was getting the vincristine, and of course it went into the tissue.
Mhm.
All right, and now we gave the client an antidote. So they put that antidote in the tissue where the medication actually is,
Right.
and they try to stop that extravasation. So
Okay.
now you're going to assess the patient after they had this extravasation and the antidote. So what do you think you're going to see now that they've had the extravasation and the antidote?
I think A would be in there. Sloughing. Extra. Well, we about to find out.
Anything else that we have or don't have?
A
So
and
it'd
C.
actually be A and C. All right.
Oh,
So
the tissue necrosis was in there.
Wow, tissue necrosis is in there.
Yep.
That means extra
oh,
cavation.
but okay. So sloughing of the tissue, effectiveness of the antidote, and tissue necrosis.
Wow, tissue necrosis. Sloughing and tissue necrosis.
So I know that the vesicant can cause the necrosis, but I was hoping by putting the antidote in that we were able to stop that. So extravasation of the chemo can lead to erythema, sloughing, and necrosis of the tissue, muscles, and tendons. To reduce the likelihood and severity, we give that antidote, okay? When we're caring for the client with the extravasation of the vesicant, then we have to assess for sloughing, necrosis, erythema, and how effective the antidote is.
Gotcha.
The nurse is completing an admission assessment for a client receiving interstitial implants for prostate cancer. The nurse documents this as what type of therapy?
Interstitial implant. Is this systemic radiation?
I want to say it's A, but let's see.
Yeah, brachy.
Brachytherapy?
Yeah. Yeah, brachytherapy.
Yeah. That's right, we're using.
The nurse is conducting a screening for familial predisposition to cancer. Which element should the nurse note as a possible indication of hereditary cancer syndrome?
It's always gonna be aunt and uncle, I thought, uh, when they talking about familiar.
Okay, because they're more immediate.
Yeah.
Okay, good. So the more immediate relatives are going to be more likely. If you notice, they only ask you about those on exams anyway. I mean, on family history anyway, when you do them. The nurse is working with the client who had an allo hematopoietic stem cell transplant. The nurse notices a diffuse rash and diarrhea and contacts the physician to report that the client has symptoms of. So allo means it came from someone similar, right? Allogenic means similar.
So graft, the graft versus host.
Good.
Mhm.
Okay, so that's from somebody who has a similar structure to us. All right, good. The nurse is caring for a client with cancer who is treating her cancer with deep tissue massage in addition to radiation therapy. The nurse documents the use of which therapy in the client's chart?
Alternative therapy? Integrative therapy.
Integrative therapy is the use of therapy in conjunction with conventional medicine. This is also referred to as complementary medicine. Alternative therapies are used instead of. Okay, so that's a difference. Complementary or integrative is used in conjunction with, and alternate would be used instead of.
Gotcha.
So that was your keyword there. Which type of immunity becomes active as a result of infection by a specific organism?
And immunity.
Is it naturally active?
I would say naturally active, because our body was activated, it activated in response to those antigens that are present. Okay. Artificially acquired passive comes from mom to baby, that kind. All right. Artificially active comes from like a immunization. I'm sorry, D is from mom. B would probably be from an immunization also, because it's artificially acquired.
Mm-hmm.
Mhm.
A 38-year-old client. Did you have a question? Okay.
No.
I heard something glitched there. A 38-year-old client has begun to suffer from rheumatoid arthritis and is being assessed for disorders of the immune system. The client works as an aide at a facility that cares for children infected with AIDS. Which is the most important factor related to the client's assessment? So she's 38 years old. She was recently diagnosed with rheumatoid arthritis and is being assessed for disorders. She works as an aide at a facility that cares for patients infected with HIV or AIDS. What's the most important factor related to the client's assessment?
Use of other drugs, maybe?
Okay, why use of other drugs?
because she has her immune system is low.
Okay, good. Which adverse effect should the nurse closely monitor in a client who takes immunosuppressive drugs?
Respiratory and urinary.
So D,
Yes.
good. A client undergoing a skin test has been intradermally injected with a disease-specific antigen on the inner forearm. The client becomes anxious because the area begins to swell. Which technique may be used to decrease anxiety in this client?
A client undergoing a skin test. Assure the client that this is a normal reaction.
Okay, when the disease-specific antigens are injected, the injection area swells as a result of the client developing those antibodies. Wait a minute, nobody invited you up here. Thank you. Proteins formed when cells are exposed to viral or foreign antigen or foreign agents that are capable of activating other components of the immune system are referred to as proteins formed when cells are exposed to viral or foreign agents.
So antibodies form proteins.
The interferons.
Interferons are biologic response modifiers. Antibodies are protein substances developed by the body in response that interact with a foreign substance, and antigens are substances that induce formation of antibodies. Complement refers to a series of enzymatic proteins in the serum that, when activated, destroy bacteria and other cells. What is an action of a cytotoxic T cell?
Oh, the T cell is going to attack foreign agent. So it attack the foreign antigens? Produce circulating antibodies.
So they're called cytotoxic T cells for a reason. What do
They
they do?
They attack foreign stuff, right?
Well, let's see.
I'm not sure.
They do attack, but they do it in a different way.
Gotcha.
All right, they're going to lyse it. Lyse it means they kill it, basically.
Gotcha.
All right, but they're only attacking the ones that are infected with the virus, because remember, these are those memory cells.
Gotcha. Ooh.
The helper T cells are the ones that attack the antigens. All right, the cytotoxic ones lyse the cells with the virus.
Okay, got you. Anybody within the helper T, got you.
During which stage of the immune response does the circulating lymphocytes contain the antigenic message return to the nearest lymph node?
Return to the nearest. No.
Proliferation.
Proliferation,
Mm.
that's
Yeah.
a growing stage.
Circulating lymph nodes.
So during the proliferation phase, the circulating lymphocytes contain the antigenic message return to the nearest lymph node. Once in the node, the lymphocytes stimulate some of the resident dormant T and B lymphocytes to enlarge, divide, and proliferate, which means to rapidly grow. In the recognition stage, the immune system distinguishes the invader as foreign or non-self, so it's going to tag it for destruction. In the response stage, the changed lymphocyte functions either as humoral or cellular. In the effector stage, the antibody or humoral response or the cytotoxic T cell of the cellular response reaches and couples with the antigen on the surface of the foreign invader.
Mhm.
In which response do T lymphocytes have a role?
T lymph.
A transplant rejection.
Good. Most immune responses to antigens involve both humoral and cellular responses, although one usually predominates. For example, during transplant rejection, the cellular response involving T cells predominates, whereas in bacterial pneumonias and sepsis, the humoral response involving B cell plays the dominant protective role. Transplant rejection and graft versus host disease are cellular responses of T cells. Anaphylaxis is a humoral response of B lymphocytes. Allergic, hay fever, and asthma, as well as bacterial phagocytosis and lysis, are humoral responses of the B lymphocytes. Which medication classification is known to inhibit prostaglandin synthesis or release?
Oh, B. Non-steroidal anti-inflammatories.
Good. NSAIDs. NSAIDs are known to inhibit prostaglandin synthesis or release. Antibiotics in large doses are known to cause bone marrow suppression. Corticosteroids and anti-neoplastic agents cause immunosuppression. Which statement accurately reflects current stem cell research?
Is it A? The stem cell is known as a precursor cell that continue. Has been performed and let them know.
Good. Okay, the stem cell is known as a precursor that continually replenishes the body's entire supply of both red and white blood cells. Stem cells comprise only a small portion of all types of bone marrow cells. Research conducted with models have demonstrated that once the immune system has been destroyed, it can be completely restored with implantation of just a few purified stem cells. Stem cell transplants have been carried out in human subjects with certain types of immune dysfunction, such as severe combined immunodeficiency. Clinical trials are underway in clients with a variety of disorders with an autoimmune component, including systemic lupus erythematosus, rheumatoid arthritis, scleroderma, and multiple sclerosis. Which stage of the immune response occurs when the differentiated lymphocytes function in either a humoral or cellular capacity?
I said the effector state. Hold on,
I thought it was the response, but I might be wrong.
you might be right.
Response.
It's a response, yeah, because it either or.
Okay, in the response stage, the differentiated lymphocytes function in either humoral or cellular capacity. Recognition of antigens as foreign or non-self by the immune system is initiating event. In the effector stage, either the antibody of the humoral response or the cytotoxic T cell reaches out and connects with the antigen on the surface of the invader. Which response is a humoral immune response?
Hypersensitivity. Transplant. Oh, delayed, right? No. I'm reading the answer. Which response is humoral immune?
Well, I feel like A and D are similar.
Transplant rejection. Cellular infection. All right. Moral. I'm gonna go with intracellular. Cellular response include humoral.
So let me just read you a little bit of difference. Humoral immunity secretes antibodies to fight against antigens, whereas cell-mediated secretes cytokines with no antibodies to attack the pathogens. Humoral immunity is rapid and quick to their action against antigens, while cell-mediated show delay through permanent action against antigens. Humoral is also called antibody-mediated immunity with assistance from helper T cells, B cells, which differentiate into those plasma B cells. It deals with antigens from pathogens that are freely circulating or outside the infected cell.
What will be anaphylaxis?
Well, again, I feel like
Yeah, the humoral response into transplant intracellular.
okay, so there you go. Anaphylaxis and cellular includes the other ones, then transplant, intracellular, and delayed hypersensitivity.
Anaphylaxis.
I kind of felt like delayed hypersensitivity and anaphylaxis went together, but I guess I was wrong on that. In which process is the antigen antibody molecule coated with a sticky substance that facilitates phagocytosis?
I can't pronounce it. A.
Oh, opsonization. Opsonization. So you have opsonization, agglutination, apoptosis, and immunoregulation.
It's a glutination, a popsination. Okay, a popsination.
Opsonization is the antigen antibody molecule is coated with a sticky substance that facilitates phagocytosis. All right, so oops, I got a sticky substance on you.
Mm-hmm.
Apoptosis, I always think about the cell exploding with that. It popped, the cell popped, okay? And agglutination is when you get that clumping. Which immunoglobulin assumes a major role in bloodborne and tissue infections?
IgM.
IgM,
No, GG.
IgG.
Yeah.
Okay. IgG, bloodborne and tissue infections. Remember, some people are born without that and they have to get transfusions. IgA protects against respiratory, GI, and genitourinary. And IgM is the first immunoglobulin response to bacterial and viral. IgD, B lymphocyte differentiation. Okay, so I don't know. IgG, the infections in me. IgA, respiratory, GI, and urine. And then IgM. Maybe you can think IG meningitis, IG, that might help you. IG meningitis. Meningitis can be bacterial or viral, right? So that might help you remember it. Which type of cell is capable of directly killing invading organisms and producing cytokines?
Cytotoxic.
Cytotoxic.
T cells.
I'm the natural killer.
Natural killer.
You want the natural killer ones?
Yeah, go with that one.
Yeah, invading organisms. Produce.
Say natural killer cells defend against microorganisms and some types of malignant cells. Cytotoxic T cells attack the antigen by altering the cell membrane and causing lysis. And remember, they lyse those viruses and release those cytolytic enzymes and cytokines. Memory cells are responsible for recognizing antigens from a previous exposure. And null lymphocytes combat organisms but destroy antigens already coated with the antibody. Which condition is associated with impaired immunity relating to the aging client?
Since everything decreases with aging, immune disease.
Is it renal function decreases?
Well, that's the only one there that decreases. Everything else is an increase.
It becomes thicker. Antibodies production. Immune disease. Yeah, there's autoimmune disease that increase.
Skin becomes thinner. Antibody production would mean more antigens were being presented in the body. So antibody production would decrease, skin would become thinner, and incidence of autoimmune disease increases with age. In other words, you're just seeing risk factors going up, nothing going down really. Chronic illnesses may contribute to immune system impairment in various ways. Renal failure is associated with what?
Then decreased bone marrow. Maybe wrong.
I was thinking B, but it's actually D.
Deficiency in circular lymphocytes.
Diabetes is associated with increased incidence of infection. Chemo causes decreased bone marrow function. Leukemia is associated with altered production of white blood cells.
Can you go back to the question? Nice. Okay, thank you.
Mm-hmm. So remember, it inhibits prostaglandin synthesis. So how is that going to affect the body?
It's going to make the platelets low. Ibuprofen affects the immune system.
All right, so B is going to be a decrease in the amount of available platelets. We already talked about A is about the neutrophil, the total neutrophils. How about C? What is that?
It's like the count for all three types of cells are low.
Okay, so none of them are functioning correctly. They're all low.
And hemolytic anemia.
So would it be hemolytic anemia? Or
Well, it's definitely it definitely can interfere with the immune system, okay? It decreases the ability of the immune system to work. It has a major effect on the T lymphocytes.
Uh,
So I don't know, maybe, let's see what it says. Neutropenia. All right, because it causes leukopenia and neutropenia.
well, in a
Yeah. Jennifer.
All right, so the phenylbutazone causes the pancytopenia, and the sulforamine sodium, which is should be Rocephin, causes the thrombocytopenia and the hemolytic anemia. Which assessment should be completed if immune dysfunction is suspected in the neurosensory system?
I know this one.
Ataxia. Is it ataxia?
That's what I would think if we're talking about neurosensory first. It's the one that's not like the others, but ataxia talks about motor movement and function of the brain. So that's why I would probably pick that one. All right, everything else had to do with urination and holy cannoli. The 38-year-old client has been diagnosed with rheumatoid arthritis and autoimmune disease. During the health history assessment, the nurse learns that the client works as an aide at a facility, didn't we do this one, that cares for children infected with AIDS,
Yeah, we did this.
but it's different.
It's a
Does
little
moderate cardiovascular exercises every day, takes no medication, has no allergies, and eats a vegetarian diet with fish and chicken 1 or 2 times each week. Okay, it's actually the same question. They just added a bunch more stuff to it. Which factor is most important when considering the status of a client?
die.
Of the client's immune system. So what do you think?
So is it environment? Hold on, let me turn.
Yeah, I was thinking like exposure to. Well, it's gender.
Oh wow.
Because autoimmune diseases have a higher incident in females than males, so that's why. I would have picked age if she wasn't 38.
Right. Hey, wait, can I read that? So
Yep.
wait a minute. 30-year-old contact RE. That the client worked as an aide. Okay. No allergies. Hmm. So females at higher risk than males are.
Yep.
Okay, I got it.
And it's correlated with the sex hormones, so more common in women because of estrogen. Okay. A nurse is caring for a client undergoing evaluation for a possible immune system disorders. Which intervention will best help support the client through the diagnostic process?
See?
Mhm.
Okay, good. "25-year-old client receives a knife wound to the leg in a hunting accident. Which type of immunity was compromised?"
Natural. What's it? Is it natural immunity? Is it natural? Okay.
Okay. A 6-year-old client is diagnosed with a viral infection of the respiratory system, which will most likely be trying to fight the antigen.
B cell. The interferon?
Okay, good. Biologic response modifier, nonspecific virucidal protein produced by the body, capable of activating other components in the immune system. They have antiviral and anti-tumor properties, and interferons respond to viral infections, and they're produced by T lymphocytes, B lymphocytes, and macrophages in response to the antigen. An experiment is designed to determine specific cell types involved in the cell-mediated immune response. The experimenter is interested in finding cells that attack the antigen directly by altering the cell membrane and causing cell lysis. Which cells should be isolated?
The B cell or the helper T. An experience with that attack the antigen. Okay.
So which
Oh.
ones attack the antigen directly and alter the cell by lysine?
That's the cytotoxic cells, right? No, wait. Oh, okay.
Yes, 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 yes. That's what I wanted you to say. The cytotoxic attack the antigen directly and lyse the cell. All right, that's what it means. Cytotoxic.
So it was asking which cells should be isolated.
Those ones, because those are the ones, and that's what it's looking for. They're looking for a cell type that's involved in a cell-mediated immune response, one that would attack the antigen directly by altering the cell membrane and causing cell lysis.
I think I don't know. I might have read into the question too much. I know that cytotoxic T cells cause cell lysis, but the way it was asking about the correct answer.
Okay. Which medication classification is known to inhibit prostaglandin synthesis or release?
We did this one, A.
Yeah, the NSAID.
Okay, good. A nurse is explaining treatment options to a client diagnosed with an immune dysfunction. Which statement by the client accurately reflects the teaching about current stem cell research?
We did this one too, I think. That's B.
Yep, it's worded a little bit different. Okay. But it was the same sort of question. Which type of cell is capable of recognizing and killing infected or stressed cells and producing cytokines? Now you notice this is worded a little bit different.
So recognizing, is that the key word?
Yes, because the other one does the lysis. This one recognizes and kills and produces cytokines.
So is it the memory cells?
No, this one's going to be, I believe, the natural
Done.
killer versus the cytotoxic, because they're both killer cells.
Gotcha.
But the cytotoxic is going to do the lysine, okay? Whereas this one, you see, it talks about recognizing, killing infected or stressed and producing the cytokines.
So it's gonna be natural. Gotcha.
But with the word recognizing it, it kind of makes you think they're talking about memory cells because they're responsible for recognizing. But I was leaning towards the natural killer.
But these are all T cells, so all T cells can remember.
Oh.
Oh,
I'm gonna have to go back and go over that.
Which condition is associated with impaired immunity relating to the aging client?
Breakdown and thinning of the skin, right? Decrease decrease. Decrease inflammatory. Increase peripheral circulation.
impaired immunity. So they're talking about immunity. So wouldn't it be decrease in
Oh, inflammatory cytokine.
impaired immunity? Breaking down and thinning of the skin. And it's not increase.
So the nurse is teaching the client about the side effects of ibuprofen. The client's learning is determined to be effective based on which statement by the patient describing the drug's effect on the immune system?
That causes neutropenia.
Which can increase my risk of infection.
There you go.
Good. So we learned that today, right?
But can you still, let me go, can you go back to the question really quick? Please. Thank you. Over just a little bit more. Okay, thank you.
The client comes into the emergency department reporting difficulty walking, loss of muscle control in the arms. Once a nurse begins a physical exam, which assessment should be completed if an immune dysfunction in the neurosensory system is suspected?
See.
Okay, good. A 20-year-old cut a hand while replacing a window. While reviewing a CBC with differential, the nurse would expect which cell type to be elevated in an attempt to prevent infection in the client's hand. So which one would be elevated first?
right? No, B cell, no. Monocytes. Eosinophils respond first, but neutrophils would be elevated. Okay. Reverse infection. Would it be the neutrophils or the? Let me see. First, elevated first. It's neutrophils, Sue.
Okay. So when I think about these in the body, okay, neutrophils are the first to arrive at the site where inflammation occurs. Eosinophils and basophils are types of granulocytes increased in numbers during allergic response and stress. So in an anaphylactic, you might see the eosinophils rise up first, right? But in the sense of the body, never let monkeys eat bananas. That tells you the which ones are most highest in the body. So neutrophils are highest, all right? Then lymphocytes, monocytes, eosinophils, and then basophils, all right? Never let monkeys eat bananas. A 34-year-old client is diagnosed with chronic hep C. Testing reveals that the client is a candidate for treatment. The nurse anticipates which type of therapy could be used to treat the client's condition.
Mm.
All right, so for the client type.
Is it the interferon? Interleukin? Interleukin? At the point. Let's up.
Um,
I wonder if the hepatitis, is it interferon? Or is it the interleukin? Is it?
Interferons are used to treat immune-related disorders, multiple sclerosis, and chronic inflammatory conditions. Ah, come on. All right, at 39 weeks gestation, a pregnant client visits the physician for a scheduled prenatal checkup. The physician determines that the fetus has developed an infection in utero and sends the client for an emergency C-section. The client is very concerned about the health of the unborn child. Based on the knowledge of the immune system, the delivery nurse explains about which immunoglobulin that will be increased in the fetus at the time of birth and will be actively fighting the infection.
Mom, daughter, bacterial virus. Is that the IgM with mom, or is it IgG? I think it's the IgM. The delivery room nurse is saying, I'm going to increase the fetus.
So IgG is an infection in me, right? Meaning it's in my bloodstream or in my body.
Right.
IgM, if it's bacterial or viral, that's likely to come out.
Mm-hmm.
I forget the IgD and the IgA. I have to look them up again.
Wouldn't be IgA. I think it's IgM. IgG.
So remember, an infection in me, bloodborne in tissues and crosses the placenta. IgG, an infection in me. IgM was the bacterial. I have to look up the A and the D again to remember them. During a 12-month well baby visit, a mom reports that the baby has been breastfed since birth and has never been ill. The mom is trying to convince her sister, who is currently pregnant, to breastfeed also, and asks the nurse about the benefits of breastfeeding. The nurse explains that immune benefits of breastfeeding and provides the mother with pamphlets. The nurse determines that the mother understands teaching based on which statement. So how does breastfeeding help us?
It's D. No. So it's the IgG.
IgA is what it's saying.
Oh, that's right. Gastrointestinal okay, vaginal secretion is IgA. I guess I want everything to be IgM. IgA 15%.
IgA is 15% of the total immunoglobulin. It appears in body fluids, blood, saliva, tears, breast milk. It protects against respiratory, GI, and genitourinary infections and passes to the neonate in breast milk.
Okay. I gotta go for my IgG.
Okay, so IgA, IG-ass protects my baby's ass against respiratory, GI, and urinary infections, and I can give it through the breast milk. IgA protects my baby's ass. IgG protects me, okay?
So it protects you, just you.
It's because the IgG is protecting me against those bloodborne and tissue infections in me.
Gotcha.
IgM, IG meningitis, bacterial or viral, so it's protecting me against those viral and bacterial infections that could be passed on. During an annual exam, an older client tells the nurse, "I don't understand why I need to have so many cancer screenings now. I feel just fine." Based on the knowledge of neoplastic disease and the aging immune system, what teaching should the nurse include in the client's plan of care? Select all that apply. Can you read those, or is it too small?
I can't see that.
All right, so the immune system is integrated with other psychophysiologic processes and is regulated by the brain. Aging of the brain can have immunological consequences and affect neuro and endocrine functioning, increasing the risk of cancer development. I'd have to say no to that. Nutritional intake to support a competent immune response plays an important role in reducing the incidence of cancer. A healthy diet, including protein, vitamins, minerals, and some fats, can alter the risk of cancer development. Yay or nay? Education about the importance of adhering to a recommended vaccine schedule should be initiated to boost the immune system function. So you want that one.
Yeah.
Tumor cells may possess special blocking factors that coat tumor cells. and prevent their destruction by killer T lymphocytes. Therefore, the body may not recognize the tumor as foreign and destroy the malignant cells. Routine screening increases the chance of finding and treating cancer early. The increase in occurrence of autoimmune diseases with aging strongly suggests a predisposition towards various types of cancer due to the body's inability to differentiate between self and non-self. Routine screening increases the chance of finding and treating cancer early. I would say that's true. The increase, do we have an increase in the occurrence of autoimmune diseases with aging?
Yes.
Yes.
Okay, would that predispose us to various types of cancer due to the body's inability to differentiate between self and non-self? Because isn't that what happens in autoimmune disease?
Yes.
So if we did routinely screen, it could increase our chance. So I would think that would be true. Now, tumor cells may possess special blocking factors that coat tumor cells and prevent their destruction by killer T lymphocytes. Therefore, the body may not recognize the tumor as foreign and fail to destroy the malignant cells. Routine screening increases the chance of finding and treating cancer early.
That sounds like something.
Nutritional intake to support a competent immune response plays an important role in reducing the incidence of cancer. A healthy diet, including protein, vitamins, minerals, and some fats, can alter the risk of cancer development. I feel like that's true in some aspect.
Competent immune response. We can go with it. I mean, nutrition.
Well, if it's wrong, you'll know it's wrong one way or another, right?
Mhm.
So the one that was wrong was C. Education about the importance of adhering to recommended vaccines should be initiated to boost the immune system. So the education itself wouldn't boost the immune system.
Mm-hmm. The vaccination would.
A nurse is developing a teaching plan for a community presentation on smoking cessation. Based on current research regarding the effects of cigarette smoking on the immune system, which alterations in immune function can be attributed to smoking and should be included in the teaching presentation.
Everything decreased. No, I don't. It won't.
Well,
It won't
so
increase.
if we stop smoking, based on current research regarding the effects of cigarette smoking, which alterations in immune function are attributed to smoking and would be included. So, would smoking decrease the body's natural killer cells?
Because it puts you at increase for infection, right? Lungs, and all that, right?
Okay. Would we see an increase in the white blood cell count?
When there's an infection.
Well, from smoking.
No, from shit, no.
We're looking for what will happen when we stop smoking.
No. When we smoke, how
Okay.
is smoking affecting the immune system?
Okay.
Which alterations in immune function can be attributed to smoking?
Okay. Oh yeah, so increased risk for infection, decreased natural killer cells, increased white blood cell count, decreased IgE antibody, decreased T cell function. I would say decreased T cell function, but I'm not too sure about what the IgE was.
Final answer?
Missing one. So it's increased white blood cell, decreased T cell, decreased natural killer, increased risk for infection.
Decreased.
So the white blood cell was one.
C.
You said that too, so you asked.
So the white blood cell count is inflammation. The elevated T cell count with decreased function, decreased antibody production of IgG, IgA, and IgM. IgE, remember, is seen in the allergic response like anaphylaxis.
Okay.
And fewer natural killer cells, putting you at an increased risk for infection. The nurse's base knowledge of primary immunodeficiencies includes which of the following statements?
Result of a treatment with anti-metabolites. A primary.
Primary immunodeficiencies.
I know it develops early in
Developing
life.
in life.
Okay, good. Management of patients with immune deficiency disorders. A gamma globulinemia is also known as a gamma globulinemia. This means without, right? Without gamma globulinemia.
That's the Bruton's disease.
Good. So lack of the thymus gland. Remember that thymus gland helps us produce most of these cells by the time we're like 13 or 14 years old. And then that thymus gland starts to decrease in size on most people. When the nurse administers IV gamma globulin infusion, she recognizes that which of the following complaints, if reported by the patient, may indicate an adverse effect of the infusion.
The tightness in the chest.
I do think that you're right, Nate. I do believe that's it.
Okay.
Flank pain, tightness in the chest, or hypotension indicates adverse effects of gamma globulin infusion. All right, that was it for those. Anything else y'all wanted to go over?
I need to focus more on immunity and drug therapy, and I should be good.